and good day. My name is Jürgen Steinmetz from eTurboNews, and this is a breaking news update. For more news updates and shows, please go to youtube.com/travel news group. youtube.com/travel news group. Here's our update.
Is CDC wrong? Antibiotics, a new COVID treatment option? With moderate to severe COVID-19 who take either of two antibiotics, ceftazidime or cefepime, in combination with a steroid is similar to that of patients given the standard treatment for COVID-19. This conclusion upends a bedrock truism of medicine: antibiotics are for bacterial infections and are not effective against viruses. Antibiotics do not work on viruses, such as those that cause colds, flu, or COVID-19, says the website of the U.S. Centers for Disease Control and Prevention, writing "do not" in capital letters too. But a team of researchers, led by Dr. Ragai Ahmad Eid of Beni Suef University, and Dr. Marwa O. El Jendi of Nada University, both in Beni Suef, Egypt, knew of cases in which antibiotics were successfully repurposed to treat viral infections after it was shown that they were able to inhibit one or more stages of the virus's replication cycle, relieve the bad effects of the virus, or manipulate the immune system to help the body deal with the virus. For example, an American study about 5 years ago found that the antibiotic azithromycin could limit the replication of the Zika virus in the brains of unborn children, thus potentially protecting against microcephaly, which is caused by the virus in newborns. In separate research, the antibiotic novobiacin was shown to have a strong antiviral effect against the Zika virus. And a 2016 study in Thailand showed that the antibiotic minocycline could be used to inhibit replication of the dengue virus. Testing in a lab setting had already shown that a class of drugs known as beta-lactams could interfere with the replication of the coronavirus. Computer simulations identified two beta-lactams, ceftazidime and cefepime, as effective at disrupting protease M-Pro, a key enzyme that the virus uses to replicate. The clinical study, conducted in the isolation department of Beni Suef University Hospital from March 15 to May 20, 2021, compared the outcomes of patients with moderate to severe cases of COVID-19 who were given the standard treatment, 110 patients, with the outcomes of COVID patients who were given one of the beta-lactams, either ceftazidime, 136 patients, or cefepime, 124 patients, together with steroid dexamethasone. This standard treatment for COVID-19, approved by the World Health Organization and the Egyptian government, comprises at least 7 different medications. The mean recovery time for patients given the standard treatment was 19 days. The mean recovery time for those given ceftazidime was 13 days and for those given cefepime was 12 days. There were no deaths and all of the patients recovered without complications. It isn't clear how much of the antibiotics' usefulness can be attributed to their efficacy in clearing co-infections, such as pneumonia, which COVID patients often develop, and how much is due to direct attacks on the virus's ability to replicate. Nevertheless, the researchers conclude in their article on the study, published in the journal Antibiotics in October 2021, that ceftazidime or cefepime can currently provide COVID-19 patients extra benefits, being good antiviral agents besides their outstanding antibacterial properties, and say that the use of either of these beta-lactams, combined with steroids, to manage moderate and severe COVID-19 cases can produce better outcomes with minor side effects, instead of the currently used complex multidrug treatment protocol. Source: Stephen Ganot, themedialine.org.
Thank you for listening to our news update. There's more on youtube.com/travel news group, or you can read us, of course, in going to our news portal at eTurboNews.com or travelnews.online.